I'm Lauren Todorovich from HelloCare, and today we'll be talking about how to COVID-proof your aged care or retirement village. There are a number of different ways people are implementing infection control methods, and this technology will help you streamline processes, cut out some of the paperwork, and make sure there's those additional safeguards to protect your residents. So it's a facial recognition tool. It will scan people's body temperature, and it does much, much more. So I look forward to sharing with you in a minute. We have John O'Callaghan, who I will be talking with about the product from Acsess Health. But before I do, I'm just going to show a quick little video about how the product works so you know what I'm talking about.
Built with IR technology and a binocular high-definition lens camera, we combine artificial intelligence to deliver you accurate readings within 99.7%. We guarantee when someone enters your facility or your building, their temperature will be within 0.3 degrees of their true reading. Imagine if your staff could use facial recognition on the terminal to sign in and sign out from their work attendance each day.
So there we have it. John, that was great. So over to you now. Tell us a little bit more about, from your perspective, and how this is helping aged care and retirement villages.
4 years ago, Acsess Health recognised in the market space, particularly in aged care, seasons, we'll call it, of flu and gastro. And we went about creating a technology using some thermal imaging and also biometric facial recognition type software and architecture to develop what we call our AI thermal camera. So we see at the moment in aged care, anyone that attends an aged care facility must have their flu vaccine, and they must also have their temperature taken. So one of the things behind this technology was creating a seamless non-contact system, and most importantly, a non-engagement system for staff. So when someone does attend a facility now, our terminal, when they engage with it, will within 0.2 of a second give them their temperature or their current temperature. This allows staff to work at the front desk and focus on what they need to do within the aged care facility and not actually have to donate their time or invest company money and time in managing the temperature of someone attending a facility. The technology then sort of develops a bit further, in which, as I said, people also need a flu vaccine to attend an aged care facility now. So we have the ability that a visitor or a staff member via a portal can actually register, upload their flu vaccine, upload an image of their face, put in their details, and also who they are visiting if they're visiting a family or a relative at the aged care facility. And what that will do at the back end is a village or an aged care operator will be able to go into a portal with pending registrants and actually go through and validate the documentation to make sure the flu vaccine's up to date, confirm who it is they are visiting when they attend the facility, and then they can approve that. And what will actually happen is the facial recognition software, when they attend the facility, will actually validate my face, go to the database, check the credentials that I've uploaded, see that they've been approved, and the terminal will actually then say, please proceed. So someone working at an aged care facility sitting at the front desk, when they hear that please proceed, they know that that person visiting has all their credentials validated by that organisation. If someone doesn't have their credentials validated, the system will actually say, please stop, see reception. So it's a way of not only streamlining, taking away that manual process of engaging to take temperature, it actually takes away this whole headache that facilities now have to meet in ensuring the flu vaccination is also up to date. The other thing is anyone visiting also has to answer COVID questions. So with the facial recognition on a separate tablet, it will pop up with that person's profile, in which they can quickly answer the questions again, sign the screen and hit submit, and it will create an electronic visitor record as well. So it takes this whole process away of aged care staff or retirement village staff needing to get involved with someone entering the facility.
Yeah, I can imagine how much time that's going to save people, because, I mean, how are they currently monitoring temperatures of visitors and team members?
So at the moment, it's still a manual process that when someone attends the facility, a member of staff will engage with the resident with the visitor, will actually manually take their temperature. Some facilities will have that then written into the book next to the visitor's name, or some other facilities that have sign-in systems have had that company now at another field for a person to enter their temperature manually into that. So, so we're relying on information being entered accurately as well, where our system is all automated. So it is what it is. So it sort of stops any manual discrepancy as well.
That's right. And I think I could imagine that people would enter their temperature, and even if it was over the range, that it would perhaps just get entered in the book, get logged, and then there's no one kind of following up with it. So
correct. It relies on two things. That you rely on people doing the right thing most definitely, but our system being a bit more intimate and a small terminal that someone engages, it will actually alarm if someone's over 37.5. So there's a series of measures that we can implement to allow people within the facility to know there's someone sort of outside a normal temperature range.
Tell us, there are some aged care homes already using this and villages. Just tell us a little bit about what's the benefits they're seeing and any feedback you've been having.
So like all things, one of the biggest things is perception. So getting, I guess, credibility and people's confidence back in getting out and about and getting back into homes, visiting their families or relatives, etc. As we understand, there's been a lot of backlash that facilities locked down. However, we all understand, involved in the industry, they're there trying to protect our loved ones that are in that facility. So having the system where we've had it installed now, the actual feedback that the facilities are getting from family that visit, they believe they're up with the latest technology. It's non-intrusive, it's quickly engaging, it doesn't cause a bottleneck at the entrance, so it's a quick flow through. Going to the next step of being able to enrol and be part of the system from anywhere in Australia. So I can be sitting at home and register myself to go and visit a facility. So not turning up and then getting stuck at reception and taking up their important time in handing over my flu vaccine and signing a sheet with all these questions on it and then getting them to approve it all, etc. It just takes away this massive manual process. So a flow back into the facility is much smoother in this type of situation. The device is intimate, so it can actually lock doors and do other things as well if someone is declared not applicable to enter a facility. And I guess it also gives the facility staff that, I guess, peace of mind that if they're away from the desk for a minute, that no one has slipped through. So it basically creates a really good audit trail for them about how people enter their facility. This will replace, we believe, staff sign-in systems for payroll, visitor management systems for contractors. So even OH&S, white card, swims and all those things being preloaded via a portal anywhere in Australia. So if you have internet access on the device, you'll be able to register with our system. And I think that's what most facilities that use our system are actually really excited about.
Absolutely.
Made overseas, it's made under license for us, but all of the software, the databases, the data is held here in Australia on secure servers. Whether it's your server or ours, the most important thing at the moment is, especially going into facial recognition, is where is that data being stored and how do I control it? For us, if you want the data sitting on your server, we can do that for you, or it can sit on our secured servers. So that is one of the most important things that we sort of talk about this technology now. Where is my image going? Where is my information going to be stored? So, and for us being an Australian-based company, we want it here in Australia.
Yeah, absolutely. I think at times like these, you appreciate it even more so, but also just from the laws that the health and aged care sector are governed by, that's obviously a huge factor in the consideration.
Most definitely.
Yeah.
So.
Absolutely. Look, I think it's great, and anything that's going to save resources internally. I mean, from the sounds of it, within a month it sort of pays for itself. So I think it's great what you're doing, and yeah, we look forward to hearing more about it.
Thank you very much for your time.
Yeah, thanks, John.